Hi, good morning, everyone. My name is Dr. Aidarus Mohamed, and today I'm presenting this research at Somaliland Health Center at Aidarus University. This research was about a disease which is Pasteurellosis, which is this topic was about pneumonic Pasteurellosis on sheep and goats. We used isolation and identification, and the area was Sheikh district in Somaliland. So Pasteurellosis disease is a bacteriological disease which is caused by bacteria, Pasteurella bacteria, which is anaerobic, gram-negative, facultative, and non-multi bacteria. So respiratory disease is a predominant in sheep and goats and is usually a result of a complex interactions between stressing diseases, both physical and psychological, and a range of infection agents. The Pasteurellosis is the most frequent type of the disease, mostly by the small ruminants. Fever, dyspnea, anorexia, recumbency, and rapid mortality are symptoms of acute illness in lambs and children. So if the animals survive, they may become chronically ill so that they can carry the disease to the other healthy animals if they are not treated well or if they are not vaccinated well. Pneumonia in sheep and goats can be brought on by a variety of things, by a variety of settings, such as bacteria, virus, and parasites, as well as stresses. So stress is the main cause of this disease. Native small ruminant pathogens are Pasteurella species. However, controlling pneumonic Pasteurellosis is a difficult job because different countries may use different strategies to control it. And even the control methods between the developed and developing countries are quite different because developed countries may use techniques which is higher and more flexible and more affordable from the developing countries and developing nations. The justification and problem statement of this study: Pasteurellosis is high priority disease that causes substantial economical losses. As we know, our economic backbone is the animals, livestock animals. So our people are not aware of this disease. So the results of this study can be used to develop and implement effective control measures for pneumonic Pasteurellosis in Somaliland and Somalia as well. Because awareness of this disease may have a significant impact to the people so that they can be aware of this disease and they can be prevented. The main problem are the lack of comprehensive research studies. So this research was the first one to carry it out in this area. And so people, they don't know about this disease and how to control it. So coming up with the different researches may be most suitable for different phenotypes and serotypes of the pathogens. Objectives of this study, the general objectives of this study was study on sheep and goat pneumonic Pasteurellosis isolation and identification in Sheikh district. The specific objectives was to characterize and isolate the prevalence of the different species of Pasteurellosis that affect the respiratory tract of sheep and goats. The second one, to estimate the related factors. So the methods and methodology, the study area and animals was the animals, sheep, and goats that are found in Sheikh district. The study design and sample. The cross-sectional study design and a process method of a sample was employed from February to May at 2023. Sample size determination. So based on the formula, we selected the threshold formula and the sample size was 385. But however, we only afforded to 100. We only afforded to sample 167 animals due to the time constraint and limited resource availability. Bacteriological examination, culture methods, characterization, and isolation was used. Biochemical characterization of isolates was used also. The statistical analysis we used the MS Excel worksheet and the JAML to analyze it. So the result of this study, the prevalence of the Pasteurellosis in alpine and caprine, as we selected this, we collected swab from lung and the nose. The tested animals, 177 animals, 117 from the nose swab and 50 from the lung swab. Positive animals from the nose swab was 39 and the lung swabs was 16. So the total of the positive animals were 55, as the percentage was 32.9 animals. This figure shows us the Pasteurella isolated from nasal cavity and lung samples of the caprine and sheep. So we used this figure shows us the prevalence of Mannheimia hemolytica and Pasteurella multicida. As we see here, the 60% of this figure is Mannheimia hemolytica, as the Mannheimia hemolytica was higher from the Pasteurella multicida. This figure also shows us the difference between the age. As the age goes down, as the disease goes higher. As the age goes higher, the disease goes down. So it's vice versa. Small animals were infected. So this table also shows us biochemical tests characteristics of the isolators, oxidase, catalyst, motility, citrate, indole, co-hedge, hemolysis, lactase, and growth of McKinley agar, both of Mannheimia hemolytica and Pasteurella multicida. Discussion. According to the isolated agents, there were 39 and 16 Mannheimia and Pasteurella multicida. So Mannheimia hemolytica is the most frequent one that affects the animals. Although the infection rate is varies, those findings was the ones that we compared to them. Other studies have reported that Mannheimia hemolytica is the most frequent serotype in sheep and goats in Egypt, as well as here in Somaliland as well. Infection rates were higher in young age groups of sheep and goats compared to the adults. This finding also agrees with that findings from Maru. There is no significant association between Pasteurellosis, pneumonia, and sex. Sick animals, well, both of them, we were not looking at the sex because all of them was infected, regardless of the sex. This line with the findings of Meru reported that the sex was not associated with Pasteurella infection in sheep in the Haramaya district at Ethiopia. So the conclusion, in general, is more ruminants were affected by Pasteurellosis in the area where this research was conducted. Both pneumonic lungs and nasal swab taken from the noses of sick sheep and goats were used to isolate the two species of Mannheimia hemolytica and Pasteurella multicida that were found. The isolation rates of Mannheimia hemolytica was found to be much higher than that of Pasteurella multicida, and that being a young animal is a risk factor for the disease. So Mannheimia hemolytica is the most frequent one that we found. So as a doctors, we have to make recommendations. So my recommendation is to make awarenesses publicly so that the people can be aware of this disease, that Pasteurella is a disease that is caused by stress, so that the people can minimize the stress. Detailed epidemiological and risk factor studies should be conducted for each serotype, the sheep and goats, and other livestock species. Animal transportation should be considered while transporting the animals to the abattoir, livestock, and anywhere, because this disease is mainly from stresses. So seasonally and transporting the animals, the stress should be minimized and the transportation should be kept on eye. So that's the conclusion and the recommendation of the research. If you have any questions, any recommendations, any comments, my contact is on the first slide. You can contact me. Goodbye.